Hi, this is Dr. P. Mageshwari, Associate Professor, Department of Pharmacy Practice, School of Pharmaceutical Sciences, Vistas. So, we are going to discuss about gonorrhea. It's the infectious disease. It's caused by the bacteria Neisseria gonorrhea. So, coming to the definition, so infection is caused by the bacterium Neisseria gonorrhea is the causative organism for gonorrhea. So, the usual symptoms in men are burning with the urination and penile discharge. So, for women, gonorrhea is a common human sexually transmitted asymptomatic of the time or have a vaginal discharge and pelvic pain. In both men and women, if gonorrhea is left untreated, so it may spread locally causing the epididymitis or a pelvic inflammatory disease or throughout the body affecting the joints and heart valves. So coming to the epidemiology, so the healthy people in 2010 target for gonorrhea is 19 cases per 1 lakh population. The total rate of gonorrhea for the United States and outlying areas was 114.7 per 1 lakh population. So coming to the risk factors, multiple or new sex partners or inconsistent condom use, urban residents in areas with the disease prevalences, adults and females particularly mostly affecting for gonorrhea. So lower socio-economic status people also can get the gonorrhea, and the exchange of sex for drugs or money. So coming to the transmission, efficiently transmitted by male to female via semen and female to male urethra and rectal intercourse. Perinatal transmissions like mother to infant, gonorrhea associated with the increased transmission of and susceptibility to HIV infection. Then coming to the microbiology, so etiological agent, the causative organism is Neisseria gonorrhoeae, gram-negative intracellular diplococcus, and it infects the mucus-secreting epithelial cells. So here we can see the gram staining techniques for identification of the gonorrhea. So the genital infection in men, urethritis, that is inflammation of the urethra, and epididymitis, that is inflammation of the epididymis testis, and male urethritis, symptoms like typically purulent or mucopurulent urethral discharges, often accompanied by dysuria. Discharge may be clear or cloudy, asymptomatic in 10% of the cases, and incubation period is usually 1 to 14 days for symptomatic disease but may be longer. And coming to the epididymitis, symptoms like unilateral testicular pain and swelling, infrequent but most common local complication in male, usually associated with subclinical urethritis. So genital infection in women, most infections are asymptomatic. Cervicitis, that is inflammation of the cervix, and urethritis, that is inflammation of the urethra. So coming to the cervicitis, so it's the non-specific symptoms, abnormal vaginal discharge, intermenstrual bleeding, dysuria, lower abdominal pain, and clinical findings like cervical discharge, easily induced cervical bleeding, and 50% of women with clinical cervicitis have no symptoms. Incubation period unclear, but symptoms may occur within 10 days of infection. And coming to the urethritis, that is the inflammation of the urethra, symptoms like dysuria, however most women are asymptomatic, and 40% to 60% of women with cervical gonococcal infection may have the urethral infection. Syndromes in men and women, anorectal infection and conjunctivitis. So this is the gonococcal ophthalmia. Here we can see the eye, the redness of the eye, it's called the gonococcal ophthalmia, and disseminated gonorrhea skin lesions in the leg. Then gonorrhea infection in children, perinatal infections of the conjunctiva, pharynx, respiratory tract, and for older children more than 1 year considered the possible evidence of sexual abuse. So antimicrobial susceptibility of Neisseria gonorrhoeae, fluoroquinolones as the first line therapy for gonorrhea. So treatment for the uncomplicated infections of the cervix, urethra and rectum. So cefixime 400 mg orally once daily, and ceftriaxone 125 mg intramuscular once daily, and ciprofloxacin 500 mg orally once daily, and ofloxacin 400 mg orally once daily, and levofloxacin 250 mg orally once daily. For coming to the special consideration for pregnant women, so for pregnant women should not be treated with quinolones or tetracyclines. So the pregnant women should treat with alternative cephalosporins. If cephalosporin is not tolerated, treat with spectinomycin 2 gram intramuscular once daily. Thank you. Thanks for watching.